Welcome to Medica Nova Wellness Studio with your educational videos about optimal health and the most innovative and holistic approach to your well-being. I hope you're all well. Recently, a mother consulted me with her newborn baby who was experiencing extreme colic pains. Needless to say, she was very concerned because it's now the third week. The baby was crying uncontrollable. She tried everything under the sky and nothing worked. Now, as you can imagine, a colic baby can make parents feel helpless, even frustrated, because they try everything and nothing seems to apply here. So in this video, I will share with you natural, effective, and also safe ways how to heal and manage a baby's colic so the whole family can find peace again. Enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families. Don't forget to click that bell as it notifies you every time I upload a new video. Thank you for your thumbs ups and your likes, because they do help the growth of my channel. I know it's a slow process, but anything helps. If you want to learn more about homeopathy, integrated mental health, health and wellness coaching, quantum healing, and so much more, go to our website, medicanova.net, at the Medica Nova Online Education Department. There you find certified home study online courses, and I will guide you step by step through the curriculums. Recently, we launched a course, an 8-week course called Positive Psychology and Mental Health, the Science of Wellbeing as a Choice. And that course was approved by the National Board Certified Health and Wellness Coaches Commission for continued education and comes with 12.5 CO continued education units. So any National Board Certified Health and Wellness coaches out there who are looking for their units to recertify their license, here it is. If you need more information, contact us at health@medicanova.net. So, what is colic in babies? Well, colic in children is synonymous to an acute distress in the child, and believe me, the alarm bells in the parents go up. It's undeniable. Its causes may be ambiguous, it can be maybe abrupt in the pattern, in the time pattern, but it's one condition that can throw the life out of gear in the child as well as the parents. It's incredibly intense. The most obvious sign is that the children in the throes of a colic, they just cry uncontrollable. There's this wailing and this maybe waking up abruptly from a sleep, and whatever you do, it just doesn't work. They do not stop whining. Even if you carry them around or have a baby massage or breastfeed them, nothing works. The affected children also often, particularly when you lift up a baby's, they pull up the little legs more towards the abdomen, and they maybe arch back in order to create more space. You see the little fists clenching, so they really want to get rid of this pain. They're irritable, they're unconsolable. Older children maybe describe the pain as feeling as something is grasping the abdomen, or there's sort of more a griping sensation, a clutching sensation. They may be bent forward or double themselves in order to sort of help the pain sort of disperse a little bit. Other children describe the pain maybe as if they're stabbed even, that's the intensity where it gets to. They try to avoid the pain by maybe pressing their hand sort of into the abdomen. With babies, when you lift them up, they push their body really into maybe the shoulder of the caregiver who carries them around. So that means they're looking for that hard pressure against the abdomen. Sometimes, you can, if there's an edge of a low table, they maybe go and press the abdomen against it because that is the only way to disperse the pain a little bit. Of course, we see other symptoms, particularly in babies. We see this distended abdomen, the bloatedness, lots of farting going on, the flatulence. And when you do baby massage or little bicycle exercises with the little legs, then maybe there's the flatulence released, and that helps too momentarily. But in general, if your child cries 3 hours a day for 3 consecutive days, or for 3 weeks in a row, your child most likely has colic. And so the main symptoms, what you look for, is this intense crying episodes. There may be also sort of a time pattern sort of related to it. So one of my sons, the oldest son, when he had colic, was 6 months old, I remember, he used to start crying at 6 p.m. in the evening, and then this 3 hours, period up till 9 p.m., and then fell asleep, exhausted, basically. But there could be a sort of a daily pattern happening, also without any triggers. As you see this arching back, they call it opitotinous reaction, maybe the doubling back, the pulling up the legs, the little fists, the recoiling to touch. The baby is tossing about in the cot, changing positions all the time. All that can give you an indication that maybe there's something abdominal happening. No doubt about it. All mothers and fathers and mamas and papas out there, you really struggle with the feeling of this helplessness and how to help your baby, because you feel, if you feel awful, having your child crying for weeks and weeks and weeks and you can't do nothing about it. But there's a reason why your baby, exhibits this fussiness, but luckily we have natural ways to heal it. And I've done it numerous times in my practice and usually see a turnaround within 24 to 48 hours. So there's no need that your child needs to suffer for weeks here. It can be done very efficiently. The medical community has different opinions about it. What could be the causes? Of course, we look at an immature digestive tract, and I can relate to that because even when the baby is born, it takes about 6 months for the baby to truly land on this Mother Earth and also develop fully the organs, right? The thymus gland, for example, which is really directly related with the baby's immune system, is coding the cells at that time with its function. The liver isn't developed fully yet in its functionality. So you have to give yourself some time, 6 months after the birth, till the baby is fully there. And sure, there may be some microbiomes, microflora imbalances happening as well. Of course, if there was maybe complications during the birthing time, cesarean sections usually deprive the baby of the good microflora, so that could be a part of it. There may be latent allergies, which we don't know yet because the baby is so young. Maybe developing brain and neurological issues. There may be some energetic stuff going on in the environment, and when the mother is breastfeeding, there may be some emotional stuff, which needs to be looked at. There may be high-strung parents. In this case, for example, the mother who consulted me with her baby, she just went through a divorce. Well, where do all these emotions go to? Of course, they go through the baby milk as well. So in this case, not only did I treat the child, but I treated the mother as well, right? And that is really the true holistic protocol here, which need to be looked at. Some theorize that some introvert babies, are more sort of easily overstimulated, but we don't know that really with a baby. We need to see what the personality is really about. But whatever it is, go to your pediatrician, go to your healthcare practitioner, go to a professional homeopath and get the right diagnosis. Because, if there's a hernia, for example, of course the child needs surgery. So we need some clear directions here. First of all, I would rule out that the baby has some baby reflux, acid reflux. It can happen. So the sour water comes up in the esophagus into the mouth. That could be a situation. Here, Just want to throw that in right away. There is a homeopathic remedy called Natrium phosphoricum 6X. I personally like the biochemical homeopathic cell or tissue salt form, nat phos it's called. Here in the US, the manufacturer Highlands produces it. In the UK, it's New Era, or look in your country where the manufacturer is, but they're called biochemical homeopathic cell or tissue salts. I would give the baby, and these are tablets which resolve right away on the tongue. They don't have any taste. Every time you breastfeed the child, right, I would give the baby a tablet till improvement sets in and everything sort of calms down more. You want to also check with your lactation consultant. Often pediatricians are not trained with breastfeeding methodology, so it's very important that you are shown that your baby latches on in the right way, because the baby can be tongue-tied or lip-tied and need some intervention here. I also want to make sure that the baby is getting enough hind milk, which is higher in fat. It calms the stomach, it helps with the digestion, and also promotes this feeling that the baby is full, as a satiety, right? So if your baby's poop, for example, is greenish or frothy, has a little bit of a mucus in it, that could be indication that the baby is getting too much foremilk, right, which causes then this digestive distress. I'm not talking about, children who are going through the teething process and also then end up with a greenish stool. It looks like salad, this green color. Now, I'm talking about newborn babies here with colic. Now, and this often happens when the breastfeeding mom has an overactive letdown or having an oversupply issue, which is of course very common in the first few months after giving birth. So check out that as well. It's absolutely important that the mother has a breastfeeding diet. Having been pregnant for 9 months, right, you couldn't have a glass of wine, you couldn't have this, you couldn't have that. Of course, the mother says, hey, I really want to be myself again, right, and has her first glass of wine. Maybe feels like she wants to have fresh fruits, pineapple, grapes, strawberries. Let's just celebrate and, get the body back into shape. All of that causes colic in the baby, especially a glass of wine and grapes, 100%. It's a direct line, right, to the baby's abdominal digestive tract. Others maybe have to eliminate wheat and gluten if there's a latent allergy there. I would say also cheeses. Now, this mother who came with the newborn into my practice, she really craved and desired cheeses, and that was the trigger. So we had to eliminate that. Anything or food articles which contained oxalic acid, strawberries, right, this kind of thing. You want to do citrus fruits, as I said, I mentioned maybe not too much orange juice, pineapple, oranges in general. Just be careful in that a little bit. Spicy foods, comes to mind here as well. I would say after the birth, I would give 4 to 6 weeks, for the baby to settle down a little bit with the digestive tract, and you help that with a clean diet. If you choose to feed your baby with formula, you maybe have to change the formula, right? Maybe there's something not right. Make sure your baby is well rested. Experiment with wakeful periods. There's sort of a general rule that newborns need to be back in bed 1 to 2 hours after their waking period. Can be even less. For some it's only 45 minutes. So if they stay up too long, then you miss the window, and then this crying starts to happen, and then the crying upsets the digestive system, and it's a sort of vicious catch here. So maybe if you feel like that has anything to do with that, start taking your baby maybe to bed 15 or 30 minutes earlier and see if that helps. Of course, love is the best remedy. Closeness, snuggling your baby helps here. You know, the baby in the womb was in a warm environment. It was snug, it was dark, it was cozy. And now the baby, is out in the open space and joined the rest of the humanity and in this crazy world right now. So of course it's a transition time. So help your baby to, sort of land gently, right? In a way, that's what I'm saying. In fact, some consider the first 3 months of the newborn the 4th trimester. Right? It's a special time. And in Japan, for example, they don't take out their babies 6 weeks after the birth, into the open, because they are aware about the sensitivity of the child's aura and the energetic field. Now the baby was in the womb, and sure, it was snug and warm, but there were also noises, from the mama's heartbeat. The digestive tract was rumbling and gurgling, the sound of the utero. So maybe make some nice sort of white noise during this situation. Maybe get an app with gurgling, mountain water running down or raindrops on the roof or whatever, just to change the environment. That often helps as well. Let the baby suck, because there are powerful sucking reflexes that needs to be really sort of satiated, and really sort of you have this feeling that the baby is satisfied on all levels. So as you know, babies put hand to mouth reflex, constantly put their hand and their fist and their fingers into the mouth, and that's a way to comfort themselves, to soothe themselves. You can also, of course, try a pacifier. But if the baby is breastfed, let the baby feed on demand, as natural as possible. So the bottom line is, let your baby or your colic baby use their natural reflexes to comfort and soothe themselves. Sometimes it helps to get the baby out, right, out of the house, put it in the pram, run around your neighborhood, just get fresh air, change the environment. Take a warm bath. It doesn't have to be soap or bubble bath or nothing. You can do it with your baby or the baby alone. Maybe take a warm washcloth, put it onto the baby's belly. That helps just to disperse the pain, because the digestive tract is also our second brain, we call it. It contains a lot of nerves, and all the emotions go through our digestive tract as well. And just warm water disperses that a little bit. It helps. What I'm basically saying, create some movement. Change the frequency of the energy. Hold the baby, walk around the baby. As I said, often it doesn't help, but why not try it in the first place? Do some body work, baby massage. I really like here, the little sort of bicycle movement exercises. There are tons of videos out on YouTube where you can learn a little bit. Yes, and maybe put some nice essential oil on the baby's belly to calm down the situation. It's all great. Other option, which I think it's helpful, would be to get your baby adjusted by a chiropractor or an osteopath who specializes in babies' treatments. Now, many times during the birth process, the baby body gets out of alignment, right? It has to squeeze itself through the narrow birth canal, which can affect everything from sleep, especially, to bowel movements, to the digestive tract ailments. So be sure you want to check that out as well. It's usually a very gentle alignment of the fluid of the brain and the spinal cord, and that can make a huge difference here as well. I also like digestive support. We want to bring in some supplement, especially if this goes on now week after week after week. I personally like Dr. Christopher Kid-e-Col colic and teething drops. Now, I'm not affiliated to the company, nor do I get any money from it, but you can order them on Amazon. I put a link down there that helps maybe. Another website called Mama Natural offers a gripe water, which is really nice. For the mother, I think fennel tea would be lovely because it soothes the baby's digestive system. So if the mother drinks 2 to 3 cups of fennel tea, it would be lovely. There's also another tea called Secrets of Tea. It's called Catnip Colic tea, colic reliever for gas and acid reflux. Also put the link below. All this helps. Now, this tea is rich in tummy-friendly herbs like catnip, fennel, cumin, and dill. And it's almost like, I call it a tummy tamer, right? It relaxes really nicely, especially when there's a lot of gasiness involved or acid reflux. I mentioned the homeopathic remedy Natrium phosphoricum. When you feel like there is an acid reflux involved, it's a really, really great help here. In general, reach out for help, educate yourself, and that's why I make these videos. So, when you're on vacation, for example, right, you're out there with your family and your baby starts to have colic, what to do? It's great to have a first aid homeopathic kit with you, so you're always prepared when something happens. And if you need more help, contact me at health@medicanova.net. I'm happy to show you here some ideas. So if you're interested in a health consultation, either for yourself or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer unique blend of natural and effective and cutting-edge homeopathic and therapeutic tools in homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and so on. Book your appointment today. For you mamas and papas out there, if you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths in achieving the very best of you, contact Medica Nova Wellness Coaching Department at health@medicanova.net. We have a 3-month coaching program, which also includes natural treatment protocols. So that will be even a better combo here to help your child as well. I'm coaching you to be well. Let's look into the homeopathic remedies for colic in babies, who are so important here. And this is where I said, yes, I have seen turnarounds within 24 to 48 hours. Almost guaranteed. I know have to be careful to say that here on YouTube, but yes, it can be done. I just want to say before I share the remedies with you, it is important if the child is breastfed, the baby, the newborn is in the care of the mother and breastfed, check out the mother's emotional and mental state too. And that needs to be maybe treated as well. The first remedy, remember I said to you when you lift up your baby and it pulls up the legs, sort of up to the knee, right? Really pulls everything up. The remedy is called colosynthesis. It's a difficult name. I write it down. Colosynthesis, 6x. The number is usually the potency, the strengths behind the name. These are Latin names. And 6x would be the most appropriate one. We have 30, we have 200, but that's all too high. So when you go to the health food store or on Amazon or whatever online supply you want to choose the 6x, nothing higher. So in case of colic, which is due to the accumulation of undigested food or gas, colosynthesis works wonders. And here comes the rain. So if you hear this nice, raindrops going on my metal roof, it's the background noise of the rain. Here we have a really nice rainstorm today. Back to colosynthesis. So for patients, adults as well, of course, for the babies who we talk about today, maybe the colic comes also after fruits, right, which were a little bit unripe. That could be a situation. In case of the colic caused due to maybe summer dysentery, colocynthis works very well here as well. It's almost like a sure shot solution, right? It's a great remedy. Some mothers complain that the child suffers colic after maybe violent emotion, and that's where I say the mother needs treatment as well, particularly if it's breastfed. There may be fit of anger, right? The baby gets very angry and then the colic starts to set in. Babies, as I said, pull up their legs. So that's the keynote with colocynthis. Now, if you see your baby's arching back, the remedy is Dioscorera 6X. It's exactly the opposite. Here we see colic, abdominal pains, especially more in the umbilical region. It's very specific. The child bends backward to get some relief, almost stretching of the body in the backward direction relieves the pain to some extent. It also is a remedy where the pain is indicated for continuous type of pain, right? It goes on and on and on and on. It goes on for weeks now. In my experience, colocynthis usually cuts it all through, and you maybe not need Dioscorera. Sometimes I've seen in babies that they have both. They have the pulling up of legs and the arching back. So I usually start with colocynthis 6, and here I give 1 tablet 3 times a day, sometimes more, every 2 to 3 hours if it's very intense in the first few days. And then as a maintenance, maybe once a day for another week or 2. That's as long as you need it. It's so powerful. If that doesn't cut it right away and you see still this arching back, then follow it up with the remedy Dioscorera. So first colocynthis, and then Dioscorera. Don't mix them up both together. Sometimes, but you need a practitioner. A practitioner maybe would say, give it in the morning colocynthis and in the evening Dioscorera. We see. But it depends on the symptoms of the child, and that's where we do individualized, personalized medicine. Another one, what I would like to share with you, a remedy called chamomilla, like chamomile, 6X. It's very effective. If you feel like the child gets these colics by being really irritable, fussy and angry. So it's almost like the mental emotional symptoms come first and then it aggravates the digestive system. Really angry. I mean, let's say the child can speak and has colic and says, oh, I want an apple juice, and you run to get the apple juice, and then it just throws the bottle through the room, across the room, where it's basically whatever it wants and you give it to him isn't the right thing. It's this complete fussiness, being angry, throwing toys around. That could be chamomilla. And it works very well here. So we talk about violent anger, right? And followed by this sudden colic then. So that could be a situation. I see the violent anger often in teething children, right? When they go into 2-3 years old and maybe not just one tooth, but several tooths come through, the back molars come through. It's very painful. You have this dribbling out of their mouths. You have the spinach green stools, the angerness. That chamomilla could be a very good remedy here to soothe the colics as well. So, there's one more product I remember from Highlands manufacturers that actually have baby colic tablets. So they bring in all these remedies in one product. You can look out for that as well. So I hope that the video today has provided you with some natural solution and useful information how to soothe and heal your colic in your babies. And lastly, take a look at our website, medicanova.net, at the Medica Nova online education with your certified home study online courses. They're truly inspiring and get you on a path to be more self-empowered about your health and your medicine. So you not necessarily always have to rely on the doctor with the white coat. They have their place, but why not become your doctor yourself? And I think your voice knows where it goes right first, particularly when you're a parent, and you pick up signs before your child even produces symptoms. And that's the inner voice, being a parent. And you can help your child way, way faster than anybody else. Now, as I said, I will put the info about the courses below in the description box, as well as some links for the products. And till next time, much love. Take care.